Start.
So I'm starting a technique with you today that I would demonstrate. It's called Rhythmic Release and Restoration, or something I refer to as the RRR. I came up with this years ago, trying to reset somebody's system. It actually came with some of the work I did with Qigong and also with educational kinesiology with Brain Gym. And I was thinking, how can I get somebody to move in 3 planes of movement when they don't cooperate? Or how can I start them a little lower? So this was an effort to start somebody's lower and get their body ready to do some of the higher level things. I'll start with him on his back, and I can move him, and he's moving all the way to his head. And then I'll come and, this is the evaluation process, and I'll come this way, and he's not moving. So I'll start back at the feet, because we're going to start with the direction of ease. I will take his feet or his ankles, whatever he's most comfortable with, and I'll move him very gently. And you want teeny movements. We can move from cellular to more of a massage, where the surface is given the resistance and we get deeper massage, and the body is the weight proprioceptive through the surface. So I'll give him a little bit of a jiggle. And then I'll go to a bigger motion where he's getting somewhat of a massage on the surface. So I'm just doing a up, down, top to bottom motion. Now I can pull away from or push to. Now pushing to, everything's moving good. Pulling away from, it's not. And so I'll continue to push to with him. But if I was concerned about somebody's neck or lower back, then I might do a pull away from. And then I can start doing a little pull away and see how he does, and see if I can get the tissue moving in a different direction. I'm considering the fascial lines, I'm considering the reflexes, and I'm considering the muscles and skin. All right, I want you to turn on your side. It doesn't take long to do a procedure. And I usually have the person tuck this, I want you to do it this way. I want you to put your hand right here, wait a minute, lift your head, right here on your neck. I'm gonna give you a pillow, right? And you're gonna put it on the side of your neck. I'm gonna have him put his hand on these muscles of the neck, because you're talking about the lateral fascial lines that we're in contact with, and they start up here in the sternocleidomastoid and the scalene muscles. So he's going to contact them with the hand, and so I'm going to move him up and down on this side. Starting with little motion and then going to bigger motion, or big and then little. You can do it either way,
Whatever.
according to the person's comfort. So I need to get enough movement, because we know that rhythmic movement changes breath. We know that breath changes vestibular, so it gives the person a nice little reset. I have some kids that we do this instead of TheraPressure programs and sensory diet. This is one of the main parts of the sensory diet when it's more effective. We just use what works, but I found that 1 out of 100 that this is most effective. All right, now I want you to turn to the other side. And I always make sure I do 2 sides, because they'll feel, and put your hand under your neck so that you're touching those muscles. So he's making sure that the hand's going across the sternocleidomastoid. Why don't we have this hand here? See if that works better. Let's have the opposite hand going across the scalenes and the sternocleidomastoid. And so he's giving his hand a hug, his neck a hug. And that can be part of the movement too. It says you're starting way at the top of those lateral fascial lines and going all the way down. So we aren't thinking skin, muscle here, we're thinking fascial. I'm thinking rhythmicity. We're just putting these pieces together and let the system organize the way it needs to organize. Do I say, oh, we're gonna get vestibular? I say we'll get what the body needs, because it's a healing process where it takes some layers off and the body will go and receive what it needs to. Might feel lighter, might feel more spatial, might feel calm. We see all those different things. Somebody might even feel a little more active. according to what the system needs. So I try not to predetermine what I'm gonna get. I wanna make sure I don't push and hurt her back. So I'm always careful of the neck and the lower back. I can press in a little more if we need more pro. But usually 2 minutes is plenty. All right, I'm gonna leave him right here while I go to step number 3. You can stop it.